Um, Good afternoon, everyone. Welcome to the 2022 Oregon Active Transportation Summit. Whether this is your first session or you've been to everything so far. My name is Cassie Wilson. I go by she, her pronouns, and I'm the Community Engagement Assistant at the Street Trust. Welcome to Beyond the Basics, how OHSU brought an equity and technology lens to enhance commute options. During the session, you can type questions in the chat or use the raise hand tool. Both are found at the bottom of your screen. And if you're posting on social media about the session or about the summit in general, please use the hashtag OATS22 so we can reshare your posts. And don't forget to visit our website at thestreettrust.org to learn more about our other programs and activities. So without further delay, I will pass things over to Bree to get us started, I believe.
Great, thanks, Cassie. Hi, everyone. My name is Bree Becker. I'm a principal at Nelson Nygaard. I lead our Portland office, and I do much of our private sector commute program work on the West Coast, commuting and designing commute programs for hospitals and tech companies and districts is really near and dear to my heart. And it is a busy world as people transition back to work. So this is a timely presentation, and we're really excited to share the OHSU story with you today. So I'm joined by my colleague and friend, Jenny Cadigan. So Jenny, do you want to say a quick hello?
Sure. I'm Jenny Cadigan. I am the program manager with OHSU's Transportation and Parking Department. I've been there almost 6 years now, and my work there does focus on TDM and employee commute options and trying to get people to our very complex campus in a multitude of ways. So yeah, excited to share our story with you today.
Great. I'm going to switch to the next slide. If you all are near a keyboard and wanting to just type your name into the chat and your organization, it's nice to see who's here with us since we can't be together in a room, and where you're coming from. So just take a minute if you can as we enter into the presentation. So the next slide, we'll just go over kind of what we're hoping to cover today. We have guys, and definitely looking for some discussion. Talk a little bit about just setting the stage and talking about how the field of what has traditionally been called transportation demand management has been changing, and how the narrative is changing to be really more focused on people. Jenny will talk a little bit about the story at OHSU. I'll talk about kind of the process side of the actual TDM plan. And then we'll have some discussion around what OHSU is thinking about doing next. And really what we're trying to do is weave in the themes around equity and access to options through the commute program lens throughout the presentation, and some focus on technology and how the many ways that technology has supported the OHSU program. Okay. So digging into kind of this changing narrative, if you want to go to the next slide, Jenny. So one more. So, you know, we wanted to touch briefly on kind of the history behind transportation demand management. This is a wonky term, to say the least. But it's one that is kind of pervasive in our work, and I think has stuck around longer than I had hoped in terms of terminology. But it harkens back to the oil embargo of the 1970s. The focus was then on energy and cost savings and reducing reliance on single occupancy vehicles. Today we think about, clients often come to us thinking about managing demand on the transportation system, having troubles with parking, occupancy, and demand, and needing to accommodate more growth. Maybe there's an air quality element, but kind of the people and who is using the transportation program and the systems that we have for them is often left out of the story. And so what we want to do today is also thread that through and kind of changing the mindset around how we talk about these programs, which helps us think about who we involve in developing the programs, how we measure the programs, and ultimately the outcomes that we're hoping for. So also, thinking back to when COVID hit, I think before COVID hit, there was a shift to start reframing the field in terms of transportation options, people accessing where they need to go, affordability. COVID, this focus on design programs for people really came front and center. It was apparent that essential workers, the ones that were left to kind of navigate transit service reductions and providing programs to help bring essential workers to the front lines was really more important than ever. But even before COVID, we know that there are deep disparities in our communities when it comes to long commute times and high commute costs that are really disproportionately hitting low-income workers and people of color. So that is one frame, I think, to help the OHSU story. And then secondly, there's a shift. Yeah, go to the next slide, Jenny. There's a shift to the focus on hybrid work. And so this is another issue that we're up against. Hybrid work is primarily available for office workers. Many people will be commuting less frequently, which is great when we think about that efficient demand management side of our work. But if everyone chooses to commute on the same days, what will happen? And what if by only commuting every so often, people's tolerance for price parking goes up and the percent of people who drive ticks up again? So these are kind of the tensions that we're dealing with as we kind of tackle the commute program problem in today's world. And so, thinking about the trends and how we tackle them, we are really needing to lean into that people focus and letting that be the motivation for how and why we focus on commute programs. And so we're thinking about providing affordable transportation options to support both hybrid work and off-peak work schedules, or tailoring programs and outreach to those who might have particularly challenging commutes or who are particularly price sensitive, and really wanting to link all of this back to why are we doing this? What are the health outcomes, both for people individually, for the community, for climate, and really letting that be front and center to our messaging. Okay, so the new commute program, as we think about it today, really providing affordable and convenient options, making sure that people who work at all times of day and into the night have safe and affordable ways of getting there. Programs who support shift workers and dynamically priced parking are a couple of examples that kind of help to solve this, and Jenny will be kind of touching on each one of these subjects on the screen. Especially with a hybrid work environment, flexibility is going to be key. So moving away from things like monthly or annual parking passes and transitioning to daily passes to provide more people with the opportunity to park when they need to. Now more than ever, commute programs are top of mind for our leaders across the organization. So commute is no longer just a facilities problem where the focus is on managing that demand, but even before COVID, the commute had become an employee retention and recruitment topic, critical importance to human resources and people teams. And so really making sure that those facilities teams, people teams, internal communications, public relations, all of those folks are around the table to help make those coordinated decisions and program ideation. And then finally, we continue to see really a focus on technology, easing implementation of programs, a tradition to daily parking, offering incentives, tracking how people travel. All of these strategies are really require a seamless integration with technology to support implementation. So with that, I'll hand it over to Jenny to introduce you to a little bit about OHSU.
Thanks, Bree. So I don't know how many of you are familiar with OHSU's campus. This photo here is taken from the Markham Hill campus atop of the tram, looking down at the Willamette River and the South Waterfront campus. The majority of our campus is up on Markham Hill, which is located just outside of the downtown core. And we also have a growing campus on the South Waterfront, and that tram plays a vital role connecting the two campuses. Being on a hill does make access challenging. There's only a couple roads that go up there. We are subject to the City of Portland's restrictions on parking, as well as a Markham Hill neighborhood plan. So parking is tight. Access is challenging. The two campuses, they are less than a mile apart, but if you were to drive between the campuses, it could take you over 45 minutes. We also have people commuting to campus 24 hours a day, 365 days a year, as we are a hospital. So parking is challenging. We have over 20,000 daily visitors, which includes our employees, our students, our contractors, our volunteers, our patients, our patient visitors, and we have about 7,000 total parking spaces. So we, for many years, have focused on getting people to work in other ways besides driving and parking. We have a huge percentage of our employees who like to commute by bike. We have the largest bike valet in the country at the base of the tram. I believe the Biketown station down there is the second busiest Biketown station in the city. All of our new buildings on the South Waterfront are built with badge access, secure bike parking facilities. We have the Moody cycle track. Biking is a big part of OHSU's commute culture. We also heavily subsidize transit passes, which pre-pandemic enabled us to have about 30% of our employees commuting by transit. So we have always focused on multimodal commutes and providing options to our employees. This map here is showing the mode split based on home location. And as you can see, the further away from the center of Portland we get, the larger that piece of the drive alone pie is. About half of our employees commute from Portland proper, and about half commute from the surrounding communities. But in 2017, our employee drive alone rate was 38%. And again, with all of the bike subsidies we had, the bike programs, the transit programs, I think by the standards of many employers, a 38% drive alone rate is great. I don't want to downplay that, but we knew that it wasn't going to be enough, especially with our projected growth. We needed to get more people out of their cars and commuting through other options. So I'm gonna pass it back over to Bree. In 2017, we hired Bree and her team at Nelson Nygaard to help us push that envelope even further.
Okay, yeah, so you'll see this is kind of the timeline that we're going to walk through today. So I'm going to touch on just a couple of items here on kind of the plan process component, and then we'll get into some of the fun details. So why do a TDM plan? So Jenny mentioned OHSU had really done all of the low-hanging fruit already. When we started this project, it was certainly, it pushed us to think bigger about what kind of programs and technology solutions we could help OHSU wade through in order to accommodate that growth that we mentioned before, to overcome the obvious deficit in parking, knowing that growth was coming, and also knowing that the city of Portland simply wouldn't allow more parking to be built in certain areas. And so we really needed to get creative about how we thought about changing the way people travel to and from OHSU. So I mentioned growth, I mentioned kind of the obvious tangible need for the plan. But I think the other piece that started to emerge as we dove into this was This was about employee experience as well. It was about making sure that OHSU was a first-in-class employer for everyone from the brain surgeons down to folks who were cleaning the cafeteria. And so there was an equity focus early on how we make this a plan for all employees at OHSU. There was also just massive complexity in the parking system in terms of how the permits are structured. They were primarily annual permits that had a whole long history of hierarchy and expectation as doctors came in and certain departments were providing annual permits to some, and then some of the low wage workers were required to buy annual or daily passes, excuse me. And so there was kind of this discrepancy and inequity in how the parking system was managed that we knew we had to tackle from an experience and equity standpoint, in addition to solving the puzzle of, do we have enough parking spaces for the demand? So it was time to rethink how parking and supportive programs were really managed at OHSU, and think about how they could give each individual equal access to modes. And so we needed to level the playing field and increase the number of people who had the opportunity to park, while at the same time making it more attractive to bike, walk, take transit, and share rides. And so the goal was to give people options and not to lock people into one mode through programs like the annual permit program. So we developed a plan. We're still calling it TDM, you might note, but maybe this next time when we refresh the plan, we'll call it something else. But we developed a TDM plan in 2017, and it followed kind of that typical roadmap of a planning process where we set the vision. We had a set of goals, which were both demand and systems focused, but also employee experience focused. Through the analysis around growth and parking capacity, we knew we needed to get down to 30% SOV. And so we came up with a series of strategies and plays that kind of helped characterize the whole world of work that needed to happen from both a facilities management standpoint, but also culture, policy, programs, and everything in between. So this is just a quick snapshot of how we laid out the plan in 2017, looking at those different kind of categories around culture, price, rewards, communication, and infrastructure. And Jenny's going to go into detail on some of our high performing, high priority strategies.
Yeah. So we adopted this plan in early 2018 and just hit the ground running with implementation. So I'm going to go over a few of those first few key strategies that we launched, and then talk about where that took us into COVID and where we are today. So there were 34 strategies in this plan. I think 10 of them were indicated as high impact, high priority, like these are going to get the most bang for your buck. So some of the first three we launched right at the same time in April of 2018 was something we call My Commute. It is our commute platform, which is hosted by Loom. So this is a place where commuters can log into their account, record their commute for the day. You can do different commute inbound and outbound. We had previously incentivized bike trips. We started incentivizing walk trips as well. And in addition to logging your commutes, you could participate in some reward challenges. There was a gamification component to it. It's also where you could request your guaranteed ride home. We started using Lyft as our guaranteed ride home operator, which was just made it more seamless and easier to use with such a large and diverse campus than our previous guaranteed ride home program. And this is also the platform that is enabling our daily parking, which I'll talk about a little bit later. We also launched a program called Lift Off. So this is targeted towards our shift workers. We have many different shifts at OHSU, but we had a lot of people that were driving to work because transit was not available for their commute in or their commute home from work. So maybe they come in at 3 p.m., they could take transit, but when they get off at 11 p.m., they can't. So they end up driving, or we have, an 11 a.m. to 11 p.m. shift and vice versa. So we launched this program. We offer subsidized Lyft rides late at night and early in the morning for those commuters. So basically the idea is they take transit for one leg of their commute and we subsidize their Lyft ride for the other leg of their trip. And then we also launched a managed carpool program through Scoop. So all three of these programs are reliant on different pieces of technology. They're also geared towards commuters that might be price sensitive. So we're, offering the financial incentives for active commutes, and we are trying to reduce the cost of the commute through the Lift Off and Scoop programs as well. Telecommute also arose as one of our high impact, high priority strategies. This was a tricky one for us. As the transportation and parking department, it was really hard for us to tell other employees that they could and should telecommute. But we really worked with our HR department and IT and other departments within the institution to try to prioritize this. Again, COVID later helped us with this one, but it was a priority of ours prior to the pandemic. And then daily parking also was a high priority strategy. So as Bree mentioned, we wanted to transition away from our annual permits, which are a sunk cost. They encourage driving. I think all you know the basics of that. And so we wanted to get people paying daily, thinking about their commute, whether they had to really, did they need to drive? Did they want to pay for parking, or was there something else they could do? And so we launched a daily parking pilot with a small audience. We had the opportunity with the construction of a new building and a new parking garage that came with it to focus on those parkers who were moving into this new garage, and they had been on annual permits, and we switched them to daily. So this was kind of our first test case of that back in 2018. And these are just some feedback we got from some of our commuters based on the new programs. The Lift Off program in particular was very popular. Really just helped people get to work safely. I think that was a big thing we didn't think about. We knew people might have a faster commute or a cheaper commute, but we didn't realize how many people appreciated it because of the safety. They weren't waiting for a bus at 11 p.m. They were able to quickly get into a lift and get home late at night. We heard from some people using Scoop that they were able to go down to a one-car household and save a lot of money that way. So it's always great. We're constantly, looking for feedback and iterating our programs. But it's always good to hear when they're working for people. So we were running these programs for about 2 years. Then COVID hit in March of 2020 and changed a lot of things. So a telecommute mandate was put in place, basically stating anybody who is able to telework, please do. We ended our shuttle operations. We started subsidizing Lyft rides at any time of day for people that needed help getting into work. For many months, parking was free. And then as demand kind of crept up again in the summer of 2020, we did reinstate parking charges. But for daily parking, we lowered the rate. So pre-pandemic, our daily parking was $15 a day. We kept it more affordable, I think anywhere from $3 to $10. And then that kind of set the stage for us to move to wage-based daily parking at the end of 2021. One thing I'll note is that even during the pandemic, we did not have enough parking for our employees. So we have enough frontline employees who are in the hospitals and the clinics providing, patient care or are helping to keep those patient spaces clean and operating efficiently, that we could not just say, okay, we have enough parking, we don't need to charge. And so that is why we had to reinstate some sort of fee to continue to help control demand, because we still had more essential workers coming to campus and we did have parking spaces. So why daily parking? Again, this was one of the key strategies we identified in our TDM plan. We did want to transition from annual parking to daily parking. Our annual parking was, more or less had some inequities built into it. I think Bree mentioned it was primarily our more senior workers. They were getting a subsidy. They were paying maybe $5 to $6 a day with that annual permit. And if you didn't have the annual permit, you were paying $15 a day post-tax. And if you look at who had annual parking versus who had daily parking, there was just some big inequities there. COVID also accelerated our adoption of teleworking. No surprise there, but with people teleworking full or part-time, we had a lot of people that no longer needed to come to campus every day, and that annual permit didn't make sense. And so, as we look into our new workforce, we wanted to offer the flexibility of daily parking and only charging people for the days that they do come to work. And, as stated earlier, removing that sunk cost does reduce the drive alone rate. So prior to COVID, we have about 5,000 permit parking stalls. So we have 7,000 total stalls, but 2,000 are reserved for patients and patient visitors. So out of the 5,000 stalls, about 4,000 were held for annual permit holders, and about 1,000 were reserved for daily parkers who had to go online, reserve, and pay that higher rate. So with COVID, when we reinstated parking fees, we reinstated annual parking fees at their full price, but we reduced the cost of daily parking. And so we had a lot of permit holders that gave up their parking pass because they were teleworking, they didn't need it, or when they did come, they would rather pay that lower rate for the daily permit. So, just a year later, we almost had equal numbers of annual parking and daily parking. And our goal was to, continue to grow that trajectory and increase daily parking and reduce annual parking. And throughout the pandemic, we kept hearing messages from our community about, the parking policies are not equitable. We need to do something about how parking is priced and who it's available to. So a lot of things about OHSU's operations were reassessed, and parking was one of them. And we restructured our parking to be more in line with our strategic plan as an institution, which did have an equity component to it. Patient parking has always been a priority of the institutions. So we wanted to continue to prioritize patient parking access. We wanted to give equal opportunity and access for people across wage groups. We didn't want to just reserve parking for the employees that could afford it. And we wanted to continue to invest in sustainable transportation options and make sure people felt like they had safe and equitable options to get to campus. So in December of 2021, just a handful of months ago, we rolled out our wage-based daily reservations. So as we prepared to return to a new normal, we didn't want to go back to our $15 a day daily parking. So we transitioned to a wage-based daily parking system. We have 7 different wage brackets. So based on, where an employee lands within those wage brackets, they will get 3 different prices for parking based on location. And we were able to implement this through our technology provider, our Commute platform, Loom. So we feed them employee roster data with wage data, and that dictates what type of prices people see when they log into reserve parking. This is, a step in the right direction. It is certainly not a perfect system. It does not solve all of the inequities in the world. We heard from employees, what about people with kids? What about people who live further away? What about adjusting for gender or race or all kinds of factors we were asked to look at? And, we're starting with wage. It's something data we have access to. And so kind of looking at the spread of what people paid for parking pre-pandemic, you can see our higher income earners with an annual permit, we're spending less than 1% of their wage on parking compared to almost 7%. And with the wage-based daily parking, we're shortening that gap. And so most employees are paying closer to 2 to 4%. So we, looking into the future as we come out of COVID, we are re-engaging with Nelson Nygaard and doing a refresh on our TDM plan. We still have a goal of getting to a 30% SOV rate, but I think, we're still figuring out what the pieces of the pie of the other 70% will look like. Nobody expected in 2017 that our telecommute would go from 1% to 46%. And certainly, we don't expect to keep a 6% telecommute rate, but it will be a much larger chunk of that pie than we had originally thought. And so we are re-looking at our strategies, looking at what we've done, what's been successful, what maybe doesn't make sense anymore, what needs to be added in to accommodate the new workforce, new preferences people have, campus expansion plans that have changed. So we know that we want to continue to focus on encouraging non-SOV modes, maybe providing larger incentives for that. In the past 2 years, we have launched a bike loaner program, which has been very successful. So we purchased a couple dozen bikes, outfitted them with, racks and lights and locks and panniers and all the gear to make bike commuting easy. And we loan them out to people for 30 days, let them kind of dip their toes in bike commuting with no upfront cost to them. If they decide they like it and it's working for them, we give them a subsidy to go purchase a new bike. We are launching a new bike share program on the South Waterfront. So in addition to Bike Town, we will have OHSU bikes available for people to get around campus since we no longer operate a shuttle. We're looking at pedicabs. I think we will continue to look at electric vehicle infrastructure and electric bikes, trying to make those more accessible to people. And, just really playing up some of those people first messages, looking at, messaging around sustainability and flexibility and changing some of the messaging around why we're doing what we're doing. It's not just about reducing parking demand, but it's about, making commute options more accessible to people and giving people multiple options to get to campus. So I think that wraps up our presentation, and Bree and I are both here to answer any questions people have.
Do you wanna, yeah, thanks. Feel free to turn your video on if you're comfortable or in a place to do so. Well, I have a couple of teed up questions. If you want me to start, or if anyone has things on their minds, feel free to chime in. Hey, Teresa, good to see you. Okay, well, I guess one of the questions that I know might be on people's minds, and certainly interested, is just thinking about what have been the biggest challenge to implement daily parking, because I know it's been multifaceted.
Yeah, I think there's been two big challenges, challenging in different ways, but I would say there's been a huge kind of cultural adoption that's been difficult for people. People feel very passionately about parking, and sometimes their right to parking. And so while this shift to wage-based daily parking made parking more accessible and more affordable to a large chunk of our employees, it also made parking more challenging and more expensive for some other employees. The people who had annual permits, this shift was not seen as a beneficial shift to them. And so we started, we kind of did a roadshow of this last spring when we were introducing this idea, and we presented to many different work groups and stakeholder groups across campus, and had to consistently iterate the plan and change it, and get feedback from people, and in some places make some compromises to what we had originally set out to do. But yeah, I would say one of the big challenges was just the adoption of it and the buy-in, both from leadership as well as the end users. And then I would say the other big challenge was a technology challenge. We had to get wage data for all of our employees into Loom. They had to do some engineering to make that translate into parking options for people. We also have people who are paid on grants and stipends, and we learned in January that these people didn't get factored into the equation properly, and we had to spend 3 months reworking this system for a small group of people. It's something our contractors and our students don't have access to. So we've heard some unpleasant things from that group that wants to have access to wage-based parking, but we don't have their wage data, nor do we have the ability to deduct parking from their paycheck like we do employees. And then just kind of getting the reservation to give access to an employee's badge to unlock a parking gate for a day. There's lots of tech systems that have to talk to one another and cooperate. And fortunately, we have a whole IT department that deals with that. But it's a complex system with a lot of systems talking to each other to make it work.
Yeah, and I think we've talked before too about just the needing some sort of calculator to really prove out that daily parking is actually not a bad thing. No one works 365 days a year, and kind of all the mess around that. So
yeah, we always called those people the mathletes, who would look at any change in parking and do their own math about, well, I work 5 days a week, 52 weeks a year, so this is how much I'm going to be paying for parking.
Right. Okay. So it looks like some questions coming in. So what have been the associated costs of the commuter bike loaner program, and how popular has it been?
The bike loaner program has been very popular. We've heard a lot of success stories, people using the loaner program, falling in love with bike commuting, going out and getting their own bike, and we're converting people to bikes kind of one by one. It's a program that doesn't have a huge return on investment right away. We only have 25 bikes. So, you know, and those are out to loan for 30 days. So throughout the course of the summer, we're maybe only going through, you know, a couple hundred people, but there was a wait list for several of the bike sizes. So we have bike sizes in small, medium, large, extra large. We've expanded our fleet this spring. The cost, I think we spent close to $1,000 per bike. So that includes the bike with all of the equipment that goes with it. So about now $25,000 we have invested into that program. But again, we do a one-on-one kind of exit interview with everybody that participates in the program, just to hear, how did it go for you? Is bike commuting going to work? Is there anything that we could help you with? And by and large, we're hearing success stories from people who are borrowing the bikes and then getting excited about bike commuting. I think there is a question about developing our own Commute app. So it is not our own app. It is the Loom app. So Loom is a company based in Seattle. I think they've been around about 10 years now, and we use their software and their Commute platform to facilitate most of these other programs I've talked about.
Maybe important to note, though, that while it is kind of out of the box, it is by no means low touch in terms of support, both on the program side, but also on the IT integration side.
Yes.
And do you want to touch on the cost? It's a per employee per month cost? Is that right? Is that how they still structure it?
That's how we pay. Yes. So we pay a monthly subscription based on our eligible users. So all of our employees and all of our students who are working or attending school within TriMet service district is automatically eligible for Loom, for My Commute. And then any contractor, vendor, volunteer, other person, we don't have any automatic feed to create their account, but any of them working within the service area can kind of opt in to create an account. So I think we have around 20,000 people in our Loom roster, and we pay, a fee per head. And then we sometimes pay we also pay a fee per month for the parking stalls that are available through daily parking as well. So there's a parking stall fee and a user fee.
Okay. So talk about where the parking revenue goes.
Yeah, so we are mostly net neutral with parking in terms of all of our parking revenue goes into our incentives and our transit subsidies. So we use our parking fees to fund our TDM program. That's how that works.
A question about working with a certain bike provider to discount new bike purchases.
We are working with one local bike shop one local bike shop and 2 local e-bike stores for the bike subsidies. You know, I think we're open to working with more bike vendors in the future. But there's 3 we currently have agreements with, and I know at least one of those bike shops does provide, they do sell used bikes, and so we will provide the same subsidy whether they're buying a new bike or a used bike. And we don't have specific stipends for three-wheel bikes or, so we do have our subsidy is $200 off an e-bike or $100 off a non-e-bike. So that's how that works. And then I see a question about, is there any discounts for parking for carpoolers? So when we had annual permits, we had a carpool permit option. So instead of paying, let's say $65, one of our parking permits was about $65 per pay period. And instead of that cost being deducted from one employee's paycheck, we could split that. If you had a two-person carpool, we could split that $65 charge across two employees. If you had a three-person carpool, we could split that charge across three employees. And so that's the way carpools were split. The parking permit was just equally split amongst those users. And when we've gone to daily parking, we have disbanded all of the carpool permits, and we pretty much just let people work out their own cost sharing for carpooling. So if you are on, if you're making daily reservations, you can just alternate who makes the reservation and who gets that parking charge deducted from their paycheck. We do not offer a lower parking fee for carpools. That is something we have looked into. Again, there's kind of a technology component needed to make that work smoothly. But it's not something that's currently available. All cars need a parking reservation, and if you're carpooling, you can work that out amongst yourselves about who's paying for the reservation that day. See a question about tracking mode split by income level. Not yet. I think that is now that we are looking at parking by wage level, I think it would be interesting to look at our mode splits by income level. And we are getting ready to do a bunch of data collection in our annual eco survey. And so I think that's a good thing for us to look into as we do our data collection over the next couple months. We do look at commute mode by shifts. Shift data is something that's always been a struggle for us. We don't have shift data in any database. It's not in our Oracle. It's not in somebody's HR record. So the shift data we have is never very accurate, and the best way we get it is through surveys and asking people. It's definitely something we always wish we had a better understanding of, knowing how many people are coming and going at what hours, but we do have a lot of shifts at OHSU, and I would say our department does not have a strong grasp of all of those shifts and the number of people in each one of them. How many staff are on our team?
A follow-up.
Yeah.
Follow-up to that is that you don't know the shifts, and then as you think about like creating programs for people and how many people will be on site, the other kind of black hole is like, what are the hybrid work policies for each department? So when I talked earlier about like getting those people around the table, that is just like a critical conversation. And in a place like OHSU, like it's super complex in terms of how to kind of get the right people in the room and give some certainty to who is coming when.
Yeah, and to add to that, when we launched our liftoff program, like we thought we would have a couple hundred people using it, and then it turns out we had a couple thousand people using it. And we have modified the hours of that program many times in the past 4 years, both expanding those hours and retracting those hours. So it's something we're always looking at. Yeah. Somebody asked how many staff we have on our team. I think we have about 25 employees in OHSU's Transportation and Parking Department. And then we have 3 big contractors under us as well. So the Portland Aerial Tram is operated by a company called Zoppelmayr. So tram mechanics and tram operators are contractors. Go by Bike Valet is a contractor. And then we work with SP Plus, which is a national parking contractor. So they do our valet parking for patients. They do a lot of our lot counts. They help with some of our enforcement and customer service as well. If I missed any questions, feel free to re-ask them or chime in. Do you ever collect mode split information for visitors and patients? We did do a survey during our 2017 TDM plan process. We did a paper survey for patients and patient visitors. Essentially, we had our valet staff in the garages giving out little survey cards. And I think we got several hundred responses, but that's a population that is hard to get access to. All OHSU patients are given a standard survey after they visit us, and through that survey, there is some questions about, your experience accessing OHSU, and so we do get feedback, both very positive and very negative, about people's experience, primarily with parking. Most of our patients do park. So we get some feedback through that survey as well. We do not at this time have plans to reinstate our shuttle service. So yeah, our shuttle, we had 2 shuttle routes. One went from Markham Hill to downtown, where we have a couple leased office buildings, and then the other shuttle was the circulator on the south waterfront. So at this time, we are not planning to reinstate shuttle service.